the clinics and hospitals. Another example is tuberculosis. It dropped from about more than 50 per 100,000 population to about 10 in 1975, and now it's down to about 2, in 1995 it was about 2 per 100,000 population, still higher than the U.S. population, but an enormous reduction. In the early 1980s, injuries were recognized as a major problem among Native Americans. The death rate from injuries was about twice that of the all U.S. population. And so the Indian Health Service, under the leadership of Dr. Everett Rhodes, who was the head at the time, initiated community injury control committees in each of the health facilities around the country. And the environmental health officers, the people who did sanitation, restaurant inspections, and that sort of thing, were assigned also to coordinate and work with these community injury control committees. And they consisted of the clinical staff. There would be physicians. I talked with one that had a dentist who was the head of the community injury control program, but also interested community leaders. People from the community, which I think is important to involve people in the community and not just have it a professional type of activity. This is not to say that there were not injury control efforts going on earlier. This is the intersection of the road that goes east and west from Ganado over here to the San Francisco Peaks and the Hopi area in this direction. And then going north here goes up to Chen Li and Canyon de Chelly. The Ganado Hospital is just down the road here a couple of miles, and they had a lot of people coming to the hospital in collisions at this intersection. And so they went up and took a look at the intersection. They said, what is going on here? Well, when they got there, this sign was not there. The stop sign for this intersection was over here. So if somebody making a right turn would probably see the stop sign. Somebody going through to Chen Li probably would not. And they were getting creamed. So they went to the Arizona Department of Transportation and got them to put up this stop sign. So there were those kinds of things going on before, but it became more systematic. And the environmental health officers and the people in the community undertook various programs to prevent falls. They did such things as distributed child restraint systems for children. They distributed strips for bathtubs, plastic strips, anti-skid strips, and that sort of thing. I obtained a contract in the mid-1980s to do a study of their efforts, hence this slide, as well as several other tables and so on. And you can see that their fall rate, when they began these programs, did start to go down more rapidly, the motor vehicle rate. But I surveyed these various communities to see what they had done and tried to correlate their activities with specific changes in their hospitalization rates for specific kinds of injuries. The correlations were fairly weak because it's pretty weak data. You don't reach very many people in a community, and there are all sorts of other things going on, such as the motor vehicle safety standards, which were reducing the motor vehicle injury rates nationwide. But there was some evidence that these were being affected. But I recommended to them that they be more like John Snow. That is, collect specific data. See if you can find clusters of specific kinds of injuries in specific areas of the community. And think about things that you can do to ameliorate these, to reduce them. And I want to describe for you a few of the projects that some of the people that I later trained undertook and the consequences. The recommendation was to collect data on who, when, where, and how people are injured, identify clusters using the John Snow type maps, and think of changes that would reduce particular kinds of injuries. And in that case, they had difficulty because they didn't really know about the science of what works and what doesn't work. So they started a fellowship program for their environmental health officers and some people in the community and others who applied for it. So each year for about 15 years, we trained from 10 to 20 of these people in how to do this sort of thing, how to do practical epidemiology and the literature on choosing things that work. And I'll just go through a few. This young lady's name is Nancy Bill. Nancy is a Navajo and was an environmental health officer on the Navajo reservation. She showed up in my course in Michigan, at the University of Michigan, where these fellows came for a summer course that we taught there. And she was extremely shy and extremely quiet. And I thought, oh, this kid will never do anything. She's now head of the National Injury Control Program for the Indian Health Service. Nancy went back home and started working really hard to do something about this problem. Her family was fairly well connected politically, so she got a seatbelt law passed for the Navajo Nation. And their hospitalization rates from motor vehicle crashes went down about a third because of the seatbelt law. And she also identified a cluster of pedestrian injuries along this road. This is Route 666, going north of Gallup to the reservation. And at one time it was identified in USA Today as the most dangerous road in America because it had an extremely high death rate. It turned out a lot of that death rate was because of pedestrians trying to cross this road. And I was quite surprised at where it is. It's about 2 miles north of Gallup. And I expected it to be, right out in front of a bar, where they were walking out from a bar right into the street and getting hit, but that was not the case. Apparently they were hitchhiking out at night, late at night, and they'd get out here a couple of miles and weren't getting a ride. So they'd try to cross 4 lanes of highway, and the speed limit here is like 55 miles an hour, and people coming downhill on part of it. And there were about 5 or 6 people a year getting killed in this little 2-mile stretch of road. So she went to the New Mexico Department of Transportation, and after a lot of wrangling with them over, quote, drunken Indians and a lot of this prejudicial stuff, she got these lights installed. The state installed these lights. They had 0 deaths on this road in the next 5 years. None. These are her lights on up the road. This is not a very good slide, but they actually put them on 8 miles of road rather than just the 2 miles, which once the state got started, they did it right. It took her a while to get them started. This young man is David Short. David lives in Northern California, up in Humboldt County, east of Eureka. And he was head of emergency medical services for the Hupa tribe. And Dave showed up again at my class in Michigan, and he walks up to the front of the class after the first class, and he had in his hand a set of papers and had OTB on them. And I said, what are you doing bringing off-track betting slips into the class? He said, that's over the bank, not off-track betting. And he starts telling me he was head, as I said, head of the emergency medical services. And he said, I am sick and tired of rappelling 300 meters down the side of these mountains, pulling people out of motor vehicles. Some of them dead, some of them very severely injured. And of course, some of them died because it took hours to get them up there. There's a thing called the golden hour. If you can get a severely injured person medical treatment within an hour, they have a good chance of surviving. After that, the chances go down substantially. So we talked about this, and David went back home, and he talked with Caltrans in California, about putting up some guardrail on these roads. And they hummed and hawed around and resisted. So he gets his video camera and goes out and starts videoing these incidents. And one of them came along one day and said, what are you doing? He says, I'm making a documentary about what's going on out here. Well, all of a sudden they got very interested in installing guardrail.